Hi everyone, this is Lola. I'm the Harvard Site Coordinator for MHTTC. Please feel free to introduce yourself using the chat box. And I just want to review a few housekeeping items before we begin. Next slide, please. Thank you.
Right. Okay.
So participant microphones will be muted at entry. If you do have any questions during the event, whether that be related to the topic or any technical difficulties, please do use the chat. This session is being recorded and it will be available sometime in the next week on our website. If you have questions after the session, please email newengland@mhttcnetwork.org. Next slide, please. These are just some MHTTC acknowledgements. Next slide, please. MHTTC Network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and lastly, consistent with our actions, policies, and products. And with that, I will hand it over to Dr. Keshavan for introductions.
Okay, thank you, Lola. Good afternoon, everyone. Hope all are doing well. It's my pleasure to introduce our next topic in this series of what we have been doing over the last 1 year of webinars on the topic of wellness, especially in the COVID pandemic context, and specifically directed to frontline healthcare givers, both mental health and general healthcare providers. And in this series, as some of you may remember, we have featured various aspects of lifestyle that impact on our ability to cope with the stresses of the pandemic, and as well as everything else that comes with it, including aspects of art and music and mindfulness and exercise and so forth. And today we have the pleasure to bring to you the next in that series by Dr. Vineeth John, whom I have known for over 2 decades. Vineeth is a professor and vice chair for education in the Department of Psychiatry at and he started his medical school in Vellore in India, and he completed his residency in general psychiatry at not far from here at the Tufts New England Medical Center, and then subsequently he grew up in his academic career in the University of Pittsburgh, where he and I worked together for many years. And now he is a professor in UT Houston. And, we have talked from time to time, and we share a common interest in the area of creativity. And on that note, it's, something that is important for us all to realize that we used to think of creativity as something that is God-given, but it is actually a teachable skill. And unfortunately, we don't teach it enough in our formal curricula in academic healthcare settings. And creativity is not only a positive factor for improving healthcare and teaching effectiveness and breakthroughs in research, but also could be a potentially valuable tool in battling burnout and exhaustion that comes with our day-to-day lives. So Dr. Vineeth John is going to tell us about how one can understand creativity and build creativity as a tool for self-growth and self-help. So with that, let me stop there and turn the podium on to Dr. Vineeth John. Vineeth, it's all yours.
Oh, thank you, Dr. Keshavan. I very grateful to be here. Thanks to Dr. Keshavan, Dr. Raquel Meshtalan-Gately, and to Ms. Lola Nedick. There's a great opportunity, and early Thanksgiving to our amazing audience. Burnout has been in the mental health vernacular since 1980s. But it's only in 2019 that WHO decided to add it to the International Classification of Diseases. Burnout has been kind of defined as a syndrome of chronic workplace stress that has not been successfully managed. And it manifests in 3 different ways. Feelings of energy depletion or exhaustion, as Dr. Keshavan said, increased mental distance from one's job, which could be defined as negativism or cynicism, and also a reduced sense of personal efficacy. The important thing to realize here is that burnout is not a medical condition. It is considered an occupational phenomenon. Now, there are many, many reasons for burnout, and some of the key reasons have been tabulated in these 6 categories. One is excessive workload. It could be lack of control. There could be poor balance between effort and reward, and this could be material rewards or intangible rewards. Maybe lack of community, which we have felt during the time of the pandemic. We are extraordinarily sensitive to fairness. So lack of fairness makes us prone to burnout. And then if there is a concept of moral distress, having to participate in a circumstance which you may consider suboptimal or unethical, it causes conflict in us, especially with our values. So when we talk to somebody and we see someone kind of suggesting that they have burnout, I'm more or less positive that quite a lot of those reasons fall in these 6 different categories. And in a survey by NEJM Catalyst, increased clerical burden and increased expectations and productive requirements has been the 2 major causes of burnout in physicians and healthcare workers. And then there are other reasons as well. There's a certain erosion of professionalism and having to answer to multiple stakeholders about metrics, and then excessive work hours as well. So the question we can answer is, or ask ourselves is, can our work kill us? In the 1970s, they did a very interesting study in the UK. It's called the Whitehall study. And this was not done on any healthcare professionals. It was done on administrative people, civil servants. So as you could see, the administrative group of people, which means CEOs and top people, have the least cumulative mortality, whereas people who are much lower in the hierarchy of an organization, the clerical individuals, tend to have the highest mortality. So, and we know from the reasons talking about, right, no control of their time, and then, significant, I would say, disproportionate aspect of effort versus reward. They may work the hardest, but may get paid the lowest. Edwin Leap is one of the champions for burnout and physician satisfaction. And whatever he writes for physician could be easily accommodated to any healthcare worker. He says, now this is extremely vital. To be happier and healthier, we also need ways to process what we see. I believe we all need a philosophy or theology to help us cope with the suffering and pain around us, and with the deep emotions we feel inside of us, to help us process evil and loss and grief and offer us hope, whether in this life or another. It is so easy to say, I'm a scientist, I don't need all that hocus pocus. Yet, that hocus pocus, those things that we call the humanities, have sustained humanity for ages and ages beyond what we measure or recall. Dr. Leap goes on to say that we need insights into what it means to be human and what it means to hope in something beyond our trouble. Art can help here. Music, paintings, sculpture, theater, film, all these address the human condition, can offer us ways to process it all. So I would say that this is a perfect segue to what I wanted to talk to you today about, the theme of creativity. So could creativity be a potential solution? That's the kind of a tantalizing question I want to ask the audience. This is the tree of life in Borneo, and it sort of talks about the power of our ancestors to be creative. And the world they lived in was wild, untamed, dangerous. And of course, this is cave painting, so they probably lacked much light in these caves. But they had the innate creative spark to spend enormous amount of time crafting these arresting, beautiful hand stencils. So the question is, what is creativity? And I've come up with a definition, which is not mine, but it's a little bit complicated. It goes beyond the traditional way we see it, but it ultimately involves some degree of production of original, potentially workable solutions to novel, ill-defined problems of relatively high complexity. Or you could say creativity is the ability to take bits of information and combine and recombine the information into novel, original ideas, making them into tangible products. So on one level, there is a process of creativity, and then which leads to this concept of creating something, which is invention, and then dispersing them into the, I would say, the world, which is for popularization, and that could be called innovation. Wanted to quickly talk about these themes, which is which are called the discovery skills and the delivery skills. Traditionally, I think we are all focused on the delivery side, following through on all our commitments to our patients, to our colleagues, our peers, to the organization. We are all extremely well organized. All of you are here right on time at 12 noon. Cautious, risk averse, never wanting to jump into new ventures quickly, able to be efficient in breaking down goals into micro tasks, and then a superior sense of accountability. So when we look at all those 5 themes in the delivery skills, I think we are acing them. But it comes to the discovery skills, where we could potentially have ideas radically divergent from others. Or then we come into meetings and we can ask questions to challenge the status quo. Why are we like this? Why is the no-show rate still so high? Or trying to find solutions by drawing on information from other sources. Able to experiment things. I'm going to try it out this way, and then if it doesn't work, I'll try it out another way. And exploring new possibilities in other fields of study. So when it comes to these themes, I think we are a little bit behind in the discovery skills. In a book called Innovator's Dilemma, Clayton Christensen, Harvard Business School, talks about 5 key behaviors of true innovators. They ask a lot of disruptive questions. They're able to build ideas from varied connections and varied inputs. They observe the capacity to, they hone the capacity to observe people and behaviors with a fresh set of eyes. They're able to experiment new things and then able to fail without being too worried about failure. So another term called failing fast. And also they're able to build diverse connections to get information and access to ideas. So maybe we could all pause for a second and say to ourselves, how much of these qualities are we bringing into our personal and professional lives? Are we questioning? Are we observing with a new set of eyes? Are you able to associate different themes and ideas? Have we experimented things? How strongly is the network? Shelley Carson is a psychologist from Harvard, and she talks about creativity. She says it's a survival mechanism for all our species. It is a means to enrichment, emotional regulation, inspiration, and motivation, and helps us to thrive in this rapidly changing 21st century. But then we believe creativity is behind us. We are constrained by the reality of our adult lives. We worry that we are going to somehow quote failure, rejection, or ridicule, and we procrastinate for perfection. We feel like unless we have a perfect creative product, we would not, we should not even be called creative. So we could ask, whatever happened to our creativity? Especially in the healthcare, we are bound by time constraints, we are bound by budget constraints. We even have limiting mindset. I'll talk to you about two of the limiting mindset in a second. We have a culture which emphasizes evidence-based practice. We feel like we have no power or agency to make any changes in the clinical landscape, which seems very rigid and hierarchical. We feel we lack appropriate collaborators to work with us to put a creative idea into fruition. We lack the motivation. We may have an idea, we may start on it, then we give up because we lack the motivation to sustain our creative drive. And then we're also very reluctant to embrace our identity as a creative person. The two minds that I talked to you about are called functional fixedness. And this is a cognitive bias that limits a person to use an object only in the way it is traditionally used. One example Harvard Business Review talked about was the huge loss of human lives due to the tragedy of the Titanic, the invincible ship which struck an iceberg and sank. There were 20 lifeboats in the Titanic, but they were not fully utilized. But then is lifeboats the only way to save human lives? And I'll come to it in a second. The other theme sometimes it happens to us is that inattentional blindness, which is a failure to notice a fully visible but unexpected object because our attention was focused on another task, another event, or an object. And if you have time, you should go and watch this YouTube video called Invisible Gorilla. And it's fascinating how extremely bright people can be blinded to something which is very much in front of them. So coming back to the Titanic example, Harvard Business Review authors talked about there were quite a lot of appliances and instruments in the Titanic, which could have been potentially used as flotation devices, like wooden tables and planks and car tires and steamer trunks and so on and so forth. And they even suggested, which is not that practical, that even the iceberg itself, because it is solid and it is long, and it could still keep people away from the icy sea, which eventually consumed them. So this is just another inattentional blindness. In a book called Whole New Mind, Daniel Pink gives us a kind of a broad picture of what's been happening to the world in the past 300 years. So in the 18th century, we were all agricultural workers. By the 19th century, we became industrial workers. And 20th century was a century for knowledge workers. But what could be the skill sets to succeed in the 21st century? And he says we may be kind of remnants of the 20th century being knowledge workers. We have a specific knowledge and we utilize it to help people and earn a living. But the 21st century may belong to people who are creators and empathizers and people who probably tap into the power of design, power of story, power of symphony, where you can bring different groups and ideas together, and a lot of boundaries are being crossed there. The 21st century could belong to people who bring meaning to our existence. So meaning would trump materialism, and also would bring in a certain sense of play, and also tap into your empathy. So this is a conceptual phenomenon. People who create podcasts and people who create extraordinarily powerful narratives in Instagram, so on and so forth. I want to quickly move into what we call models of creative process. To me, this gives us some kind of a framework to look at our lives and say, could I be creative? If I am creative, how do I move from just this notion of being a creative person into actually living the life of a creative person? And there are multiple models, and most of them sort of talk about the capacity for one to tap into the power of our community and the power of collaboration. And I'll go through each of them soon. So one of the models is called 4P creativity by Melrose, and it talks about the fact that any creative endeavor is a product of a place, which gives the climate, creates a culture of creativity, gives us a context. And then the person itself, the creative person, and the kind of process they eventually find or intuit upon to create the creative process, eventually leading to the creative product. So that is the 4P level of creativity. My favorite model is this called 4C model of creativity, where one could move from a mini C, where one has changes within oneself. Nothing is evident to others around us. It's more of an epiphany within ourselves. We thought of the world in a particular way, but then we had an epiphany and we changed as a person, but nobody else is in some way affected by this creative change within us. So that's a mini C. What is little c? Little c is everyday acts of creativity we do, and it influences and impacts individuals and zones of activity around us. So for example, if I'm working in electronic medical record system and I found some smart phrases and smart kind of a way to make a note very effective and succinct, and I share it with people around me, that is a little bit of what we call a little c, or everyday creativity. But most of us could aspire for what we call professional creativity, which is called Pro C. And one good example I could see from my life is Dr. Keshavan. I knew Dr. Keshavan in 1998. He ran a very interesting research experiment on first episode psychosis. And part of that came from his own work in the extremely acute and intense schizophrenia unit. He was a medical director of that unit. And he used that clinical expertise to expand his creativity and go on to do immensely valuable research studies. So this is what most of us could aspire. And then the final big C is when eminent creative enterprises, which is well known to all of us in terms of music or art or literature, which is acknowledged worldwide. And then the 4S model is more like a 4P model. You need the soil, which is your resources and your experiences, but you also need the sun, which will give you inspiration and encouragement. And sometimes there could be challenges and conflicts and crisis, and that may be the storm. And also you need the space to think and be alone and be able to indulge in your creative enterprise. In 1926, Graham Wallace from London Business School said, every creative thought has 4 phases. There's a phase of preparation, where you collect the background information and you focus on the problem. Then there is a passive process of cognitive synthesizing called incubation. And then comes the phase of illumination, or what we call eureka, moment of epiphany or aha moment. And then another phase of implementation or verification. So first you have the background information, then you allow it to simmer for a while, and then there is a moment of clarity, which eventually leads to further for testing and verification. In a book called Runaway Species, professor of music at Rice University in Texas, Anthony Brand, neuroscientist, David Eagleman, said that every creative process is actually 3 things. Either you bend an idea, you break an idea, you blend 2 ideas together. And the final theme I want to talk about, which is getting a lot of traction in medicine, is this idea called design thinking. And quite a lot of perennial and complex issues in medicine and healthcare could be helped by utilizing this theme called design thinking, where you empathize with your user needs, and eventually you define what the real problem might be. And then you come up with a lot of ideas. You don't worry about which ideas are good or bad. And then you quickly prototype a kind of a solution and test it out, and then come up with the most optimal prototype. So in one way, you empathize with your user. What are your needs? What are you feeling? What are you thinking about it? And then through the distillation of these interviews you have with the user, you eventually find a problem, you define the problem, you brainstorm the idea, figure out a prototype, and you test it. And there's a wonderful book called Health Design Thinking by Dr. Monku, which is definitely a wonderful read. I also want to mention this theme called flow. And one of the ways you could define flow is a state of self-forgetfulness, the opposite of rumination, worry. And these moments of flow are egoless, and they have a masterly control of what they're doing. And although people perform at the peak while in flow, they're unconcerned with how they're doing, and there are no thoughts of failure or success. The sheer pleasure of the act itself is what motivates them. So flow is a theme we all have been into, but the question is, could creativity flourish when we are in the flow states? So when they look at the neurobiology, flow requires a lot of expertise. It also requires a lot of intrinsic motivation and capacity to continuously improvise. So on one level, if the challenge is too high and your own skill set is low, you go into the anxiety state. The challenge is too low and your capacity skill is very high, you could be bored. The flow is an optimal state where you could be continuously challenged, but you have the right skills to navigate the challenge. So I'm moving into these themes which I've been thinking about what could be the forces that may drive creativity. This is truly my own list, and in no way I would claim that this is in any way complete, but I wanted to look at what may be some other themes which could help us. And maybe we could get inspiration from some of these themes as well. So the first theme is called the chance, otherwise serendipity or coincidence, or fortuity, luck, providence. All of this is this theme called the chance. Serendipity is defined as chance interacting with human action, leading to usually positive outcome. Now, they've studied serendipity more than we would want to imagine, and they feel like serendipity is actually a process. You have to be prepared, and then you have to notice. And this noticing comes purely by accident, and you have no control over it. There's a surprise factor to it. And then it leads to what we call a fortuitous outcome, and there is a happy ending and gain. The truth is, while all this is happening, a prepared mind noticing something purely by accident, leading to a wonderful outcome, the person is not aware of what is really happening. Only when time has passed, when we reframe the events, we are convinced that it was all serendipity. So that is something to think about, that we may have to look at events in our lives which we would now consider luck or serendipitous. What were the factors which led to that particular event? And Louis Pasteur himself said, chance favors only the prepared mind. And if you look at how a novice looks at things, a novice is always following the rules, while an expert purely they have an intuition. A novice mind is very cluttered because they consider everything. The expert is quickly able to find patterns. Novice continues to be a detached observer, or expert is part of the system. Novice is backed up only by explicit knowledge, where the expert has tacit knowledge. And then novice falls back on formal learning, where the expert is always focusing on informal learning. A story is to suggest this about how expertise comes into play happened in Jan 15, 2009, US Airways flight 1549 took off with 150 passengers and 5 crew members. And within seconds of it taking off, flock of Canadian geese struck both engines. The pilot was asked to land the plane at a nearby airport. He deferred and concluded that the best option was landing in Hudson River. And you already know it's called the Miracle in Hudson. Why am I bringing this story? The pilot was Chesley Sullenberg, otherwise called Sully. And if you look at, this is a mini resume. He has started flying at age 16. He had tens of thousands of hours as a commercial pilot. He developed multiple safety protocols, and he also developed training courses for flight crews as well. So when asked about this event, Sully said, one way of looking at this might be that for 42 years, I've been making small, regular deposits in this bank of experience, education, and training. And on Jan 15, the balance was sufficient so that I could make a very large withdrawal. So luck favors the prepared mind. This is a story which happens in September of 1928. Alexander Fleming returns from a holiday. He keeps a messy office, which gives me great hope. And he noticed that certain colonies in this agar plates were missing from an area around a contaminating mold. This is purely seen as an accidental contamination. They even speculates that the mold entered through the open window. Dr. Fleming kept a messy office and kept his window open. So what happened after that is that he realized this may be the beginning of an antibacterial and antiseptic impact of the mold. And then penicillin notatum was the mold, and an era of penicillin was born. Now, one of the most well-known fact that he's discovered of penicillin, but he was also a microbial art specialist. He would make these paintings purely by the colors created by the microbes, which means that he had a capacity to observe that act of clearing in a very intrinsic way. So in many ways, he was an expert, and this helped him to distinguish why that area of clearing happened, which led to important discovery, which saved millions of lives in World War II. These two gentlemen, the younger one is Barry Marshall, is a gastroenterology registrar, and Robin Warren is an older gentleman, he's a pathologist, and they were studying duodenal aspirates. Their speculation was that the ulcers were due to a bacteria in the gut, and which is hard to imagine at that time because everybody thought the acid in the stomach would kill off all bacteria. So what they did is they created duodenal aspirates and tried to develop cultures. And they usually kept the cultures for about 48 hours. And all the first 36 cultures were found to be having no growth at all. But then in April 1982, while the study was going on, an MRSA outbreak happened in the same hospital. So people forgot about their cultures, and they only discovered that 5 days later. Guess what? That particular organism, which is causing these ulcers, required 5 days to grow. So they went on to publish this in Lancet in 1983, and then an original article in 1984. And later people acknowledged that when they got these letters to the editor, they were not ready to accept it. They went against the way of thinking at that time. And it took a lot of effort for these letters to be coming down. But what is amazing is that almost 20 years later, they were awarded the Nobel Prize. So around that time, discussing this particular event of them winning the Nobel Prize, Dr. Julie Parsonet wrote that in the following in NEJM. At the time of the discovery, Warren and Marshall were physicians doing the daily jobs. They were not in the laboratory chasing after the Nobel Prize. They had no intention of being in the limelight. They had no research grants for studying ulcer disease. Rather, they happened upon something interesting, and driven by curiosity, they investigated and reported it. They again proved that we, as physicians, healthcare workers, can make groundbreaking discoveries in the course of our clinical practices if we attend to our work with an open eyes, a sense of curiosity, a desire to understand, and a willingness to pursue ideas to their completion. So serendipity has been studied in library science. You know, when we go to the library, let's say I want to read about Nigeria, I could go and get a book on Nigeria. And if I take the book and I come back, I'm called a non-encounterer. Or I could go to the library, get a book in Nigeria, then I want to learn more about Africa. I took 2-3 books, hung around for a few minutes, I come back, I could be what we call an occasional encounterers. But serendipity always happens to people who are called super encounterers because they always linger around, one thing leads to the other, and they always find themselves to be extraordinarily lucky because they are always open to possibilities. So this is how you could look at it. You could go into the library, you notice something, you stop, and you could go a straight line, and that would be a non-encounterer. But you could also take a detour, which is happening in this picture. You could examine it, you could take other background information, stay around, and then you could come back. And that is more of a strategy of a super encounterer. The story of Viagra is even more interesting. Initially, it was antihypertensive agent, and it was in a clinical trial. And the complete trial was deemed a failure. And patients who were in the trial were asked to return the samples of this agent. But then they noticed that elderly male patients who were subjects of the study failed to return the samples. And it could have been seen as an odd occurrence, and the company could have forgotten about it or ignored it. But some of the ingenious executives went after that information, and then a blockbuster drug was found. Even in the world of psychiatry, so many medications like lithium and chlorpromazine and MAOA inhibitors and tricyclics, and even aripiprazole as an adjuvant for antidepressant, are all, I would say, product of serendipitous discoveries. So along with serendipity, comes the act of observation. It's to really observe, we have to have an active experience. We focus on our senses and engages our environment. It has to go beyond our subconscious filters, and we have to pay attention to details. And so there is something here in this picture. If you notice it, I'm going to give you the answer in a second. But quite a lot of times, this particular artifact was missed by even experienced radiologists. And I want to tell you what it is. It is a gorilla embedded into the CT of the lung. And then if you look at radiologists to naive observers, their inattention blindness rates for radiologists is even very high, 75%. Naive observers, about 95%. So radiologists are not any better. But then when it comes to detection of the nodules, radiologists are much better than naive observers. I want to move into this concept of collaboration. Most of us sometimes may live lives where we are solitary practitioners, but there is power in collaboration. And there is a theme called Power of Two, where you can look at someone like Paul McCartney, John Lennon, where John was the badass older brother Paul never had, and Paul was a charming sidekick who could do something very rare. He could keep up with John. So what I'm trying to talk about is this concept called compensatory genius, where a brilliant mind could make up for the shortcomings of another brilliant one. And as we look at our lives, we should look at who is somebody who makes up our shortcomings. If I'm a visionary, who would be able to execute it? And that is called compensatory genius. Another interesting study looked at locations of people who were involved in research studies. So from 1990 to 2003, they looked at all the articles coming out of biomedical science from Harvard. And each collaboration was geocoded to the location of the first author and the last author. So if there is no distance between the first or last author, that is 0. If there are further distances, then that is calculated simultaneously. So as you could see, if the first author and the last author are not going to be together, they are going to have much more higher level of citations. This is a building called Building 20, and it is a very messy building. People have to walk long distances, and it was in MIT. But then it is the building where radar, world first atomic clock, Amar Bose made Bose speakers. Only because it was such a long building, people got lost all the time, and they had to find one another to help them out. And it was called the magical incubator, an eccentric amalgam of people who knew little to nothing about each other, but they're all thrust together within walls of what seemed like an awful building. So again, collaboration is the key. So then the second question in collaboration is it good to have collaboration with our friends? For that, they did a study of all the Broadway plays, which happened between 1877 to 1980. And they looked at people who had worked together a lot, and they would be what we call Q, which is an index of familiarity. And then if people didn't work together, they were low Q, and then the medium Q. As you could see, we all would guess that high Q will result in much better Broadway plays, but the answer is not true. Answer is a medium Q. The actual number is 2.7. So when asked about it, the person who did the study said, people have a tendency to want to work only with their friends. It feels much more comfortable, but it's exactly the wrong thing to do. If you really want to make something great, you are going to need to seek out some new people as well. So The third theme in creativity is competition. And the story here happens in UK, where there were multiple groups looking for finding out the structure of the DNA. There was the Cambridge group, there was the King's College group, there was even Caltech University group. And then Dr. Rosalind Franklin did a photograph, X-ray crystallography of DNA, which eventually fell into the hands of the Cambridge group. And then they leapt into the conclusion that DNA was a double helix. They published it, shared the Nobel Prize with Dr. Franklin's boss, Dr. Wilkins. And that is another way of looking at creativity. It also happened when they tried to discover the AIDS virus. The two key people were Robert Gallo and Luc Montagnier, and they were working together. Then Dr. Gallo announced that he found the AIDS virus, but it was fully disputed later, led to huge international kind of fiasco. And in the Nobel Prize in 2008, they forgot about Dr. Gallo and gave it to Dr. Montagnier. Another theme we need to think about is called clusters. They say that best work tends to emerge in a place where all the best people are. In a theme is that Silicon Valley came out of open culture in the California region, but the theme is that you need to have outstanding university research and commercial linkages. You need to have appropriate base and knowledge and skill. You need to have diversity and quality of the place and a sense of psychological safety. And this is what people think would create creative clusters. The other theme in creativity is curiosity. And Leonardo da Vinci has been, in a way, thought as the most curious man. And quite a lot of times, his notebooks display how much time he spent on trying to figure out what the tongue of a woodpecker may look like, why the sky is blue, or how does an emotion form on someone's lips. And this is a story of a man who went to Milan from Seattle for just another, wholesale coffee kind of a conference. But he was struck by the vibrant atmosphere in Italian cafes. He tried to bring it back to Seattle, started his own coffee shop called Il Giornale, which became so successful that he bought out his parent company. And you know what I'm talking about, that is Starbucks, and the man's name is Howard Schultz. So curiosity is all about questions. And sometimes questions are much more powerful than answers. And as our world becomes complex and dynamic, we need to start focusing on asking the right questions. And let me talk about some of the barriers of curiosity. Our negative emotions, a sense of hurriedness and haste and overconfidence kills curiosity. And in our day-to-day life with our patients, curiosity could give us ample access to our patient's personal details. It could be a great learning opportunity. It could trigger more research. It could also give us ample data collection as well. But then curiosity has been compromised. There is little time at the bedside and overemphasis on efficiency. Everybody is learning to the test, and technology is focused not on the patient, but more on billing and so on and so forth. Another theme in creativity is, well, how do we do when there is a crisis? So in 1970, there was an explosion that left Apollo 13 leaking oxygen. 3 astronauts' lives were at stake. The dream of lunar landing was nixed. NASA engineers in Houston were directed to create a filtration system utilizing components easily available in the spacecraft for astronauts to use and to communicate that to those astronauts. And they did exactly that. So crisis. And Dr. Keshan mentioned the pandemic has made us adapt to so many challenges in a creative manner as well. And another theme in creativity is called convergence. There's a theme in creative complexity science called Medici effect. It refers to the time in history where there is a confluence of ideas, culture, and thought. It happens when diverse industries and disciplines meld, intersect, clash, and cross-pollinate, and leading to the emergence of novel insights. And breakthrough ideas often occur when we transport concepts from one field into new, unfamiliar territory. So in a way, creativity occurs at the interface. So convergence medicine is a new frontier for us. And there are so many now convergence medicine institutes all over the world. This is a Stanford Institute. I want to take a last few minutes to just talk about that. There is a whole lot of work done in the neuroscience of creativity. And one of the themes is about default mode network. This is the network responsible for your thoughts about you. The other two networks are salience network and central executive network. But default mode network is getting a lot of importance because it helps us to daydream. It also helps us to envision our future. It also helps us in the moral decision making. And then daydreaming is critical because we need a place free from stimulations, stimulate distractions. And they've noted that walking leads to less stress, boosted engagement, a better mood. And daydreaming is technically envisioning the future. It's almost autobiographical planning. And in a survey done by, and here is a conflict of interest, by a shower company, they got that 72% survey respondents got new ideas in the shower. And then there's also this theme that quite often we could have automatic constraints, which are very strong, which then leads to rumination, obsessive thoughts. And we can also have deliberate constraints, which are we keep to ourselves. If it is very strong, we control our thoughts, it is goal-directed thought. But if we can relax a little bit of a deliberate constraints, then that's a perfect time for creative thinking. And then they've also looked at the aha moment. How do we have the sense of epiphany? And one of the ways they did it is that they used a test called RAT, or remote association test. And researchers asked them to look at one word, which will go on with every other word, called fish, mine, and rush. And the right word is gold. And when people got that right word, gold mine, gold fish, gold rush, they pressed a button. So they studied their brains. And they realized that the moment they got a creative insight, there was a sharp increase in the right anterior temporal lobe at the moment of insight, which is fascinating. And then Charles Limb is a neurosurgeon, and he put jazz musicians, under neuroimaging, and he found that when people are playing jazz, there is much less self-monitoring and much more capacity for self-expression. So, wrapping up, how do we become creative in our own professional lives? We have to choose a domain. We have to move to the cluster or the center. We have to get to know gatekeepers. We have to be intrinsically motivated. We have to learn to collaborate and not worry about who gets the credit, and sometimes take risks. And quite often, creatives are able to vary their routines. They're very observant. They make mental space. They relax the boundaries. They draw on their previous experience and look for patterns. And they're always in the trying to seize the opportunity. So my final word is that let's engage in activities which put you in a flow state. Let's resist conformity. Let's take control of our schedule and look at things around us and connect those dots and be prepared for serendipity in our lives. Take some time for daydreaming. Try to shape your space around you. Do some, I would say, brainstorming to find your perfect compensatory genius or your creative partner. Look at what you like about what you do and what you hate about your life, and start doing more of what you love and less of what you hate. Again, thank you so much. It's been a true delight and pleasure.
Thank you very much, Dr. John. That was a wonderful tour of a really fascinating topic. But there are a number of questions on the chat, but I would like to ask Dr. Max Mayer, who said that he wants to share a particular creative idea. So, Dr. Mayer, do you want to do that? If you're still there. Okay, so while he is, about to come back to his Zoom, Dr. Kelleher also says, yes, lines up nicely with bibliotherapy and cinema therapy strategies. Do you want to say anything about it, Dr. Kelleher?
It was sort of commenting off of Dr. Mayer with Dungeons and Dragons and being creative with themes and empathy, by using that. So hearing that just brings me back to the 80s and how much we're able to use things like movies and characters and books to help people, with that.
No, Dr. Kelleher, that's fascinating because in a book by Stephen Johnson, who's a creative expert, he says, only way to be creative and develop empathy is to read a lot of novels. Because, a novelist spends enormous amount of time trying to understand the character and the emotions behind it. And by living in that world, we are expanding our own sense of empathy. So and that's a skill set a lot of my medical students have lost. They don't read anything these days. But I think if you could get back into the habit, that really enhances our level of creativity and empathy as well. Thank you.
So can I ask a question, Vineeth? You're an educator as well as a creative writer. Do you think that our system of medical education is killing creativity? When we spoon feed so much, when we give so many algorithms for people to follow, and so many, cookie cutter books and procedures and so on, are we really killing creativity?
I think this is something, when we ask our medical students about this, they say that they were creative till they entered the medical school. Then they felt like nobody values their creativity, and they are asked to, go through enormous amount of data and regurgitate it to do well in tests. And even in clinics, people are expected to answer in a particular way. And any kind of a question which is diverging from the theme or the efficiency of the clinic is not encouraged. So they kind of quickly learn that it is okay to suppress your individuality and confirm rather than go against the grain, so to speak. And a lot of creative breakthroughs happen by people who are iconoclasts, who are moved away from the traditional. There was a story I read about somebody who won the Nobel Prize much later, but he used the urinary catheter to create a vascular catheter. And he actually went to the X-ray and made sure that he actually entered the chamber of the heart from an incision in his cubital fossa. And the first thing his chairman did was fire him. So he could not get a job in vascular surgery, and eventually became a urologist. It happened in Germany, and his name is Frostman. But this is a sad part of medicine. You do something a little bit, away from the tradition, then you are confronted with a whole lot of resistance and even disciplinary actions.
Yeah, no, thank you. I think that brings me to the other point I was going to say is, you gave a very nice way of remembering all the key elements of creativity, like the 7 C's. I would add another C to that, and that is courage, because a lot of creative ideas just get shut down. All through history we have seen that, and it is only the courageous ones that have made them become reality. Go back into history. There are so many examples of that, and it's important as educators and as professionals ourselves to have the courage to kind of exercise some of the ideas that emerge from curiosity and challenge. Challenge is another C, I would say. Challenge the dogma, right?
Right. No, that's great, Dr. Keshwan. I think everybody says 7. So, but I totally think this adds to the level of the creative forces. Definitely. Thank you.
Yeah, you can add one more and call it the 10 commandments of creativity. Other thoughts or questions?
I have 2 thoughts. The first one, I was thinking about the daydreaming and thinking about that, like young children who are in school who are often daydreaming and how we kind of pull them out of it. So that was interesting. And then the second thought I had was around the Titanic. And I was just under the impression that we operate under crisis in a different part of our brain. So does the creative piece, if we practice it, will it have an impact when we are in crisis mode?
Right, that's a wonderful theme as well, and I think this is it that Ken Robinson talks about creativity and how schools kill creativity, and that's exactly the point. Is that these kind of creative outbursts in our children and all that is currently discouraged by the traditional school system, and so that's very relevant. And a lot of this mind wandering could be, I mean, of course, is excessive to the point of not studying or not keeping track of what's been taught is one issue, but even encouraging mind wander to some extent is a really wonderful way to keep our creative forces at play. And the Titanic part is important, that under crisis, some of these phenomena completely fails. And quite often it's about looking at associations in advance, being prepared for it. So I understand that at that very moment, looking at the iceberg as a way to save people. But apparently many years later, there's a similar incident which happened with another ship, and they were able to scramble into the iceberg, and some lives were saved because of that. So appreciate that thought. Thank you.
Thank you.
Dr. John? Hello?
Yes, Dr.
Yeah, hi. Fabulous talk, absolutely, very informative. I just want to make one point, and that is the role of passion in creativity. And specifically, I would like to talk about the famous mathematician, Srinivasa Ramanujan, who lived in India in the 1920s in obscurity. An interesting thing about Ramanujan is that he often failed his math exams because he would just not attempt the questions that did not interest him. And he just did what he truly was interested in. And he eventually went on to become one of the greatest mathematicians. So sometimes I wonder whether we kind of become too general in our knowledge and not dig deeper and deeper into what really we are passionate about, and whether that is a way to go to be a more creative person.
Right, and that's an interesting point, because quite a lot of times people thought we all have to be a T, like we have to go deeper and deeper. But now people are saying being a journalist is also a very powerful part of being creative as well too. That's part of getting ideas from other fields may help us too. So as our world become complex and ideas become complex and problems become complex, getting inspiration from other fields may help us too. But Ramanujan's story is very powerful. And even now, some of the theorems are still getting proved. So thank you.
Absolutely.
I just want to make one point about the neuroscience of creativity. You brought in the idea of the default network, being allowed to wander, if you will. That's the wandering mind part of the brain. And that is great for generating ideas. When you're mindfully meditating, you're letting a free rein to the default network system. But I would also argue that the opposite of the default network is the task network. So when a musician or a sculptor or a painter engages in a task, he's not using his default system. He's intensely focusing on a task system. So he's actually leaving everything else out and focusing on one thing. That circuit which draws the painting or sculpts the sculpture and so on. So it may be that there are multiple ways in which the brain expresses creativity. For the flow that you talked about, one needs to use an intense task activation of the brain and suppress the default system, which clutters the mind in some ways.
Right. I think default network is helpful to generate the ideas. Then you really need the focus to really pull that into implementation. So you need all parts. But default network is really taking off these days, Dr. Keshwar. I think that a lot of people are really looking into it. And one level is mind wandering, but the other thought of default network, when there is not too much activation, is the rumination part of it. So people are interested in that as well.
Yep. So we are at 1 o'clock. Thank you all for staying on, and thank you so much, Dr. John, for this wonderful, highly creative, detour on creativity, which we don't hear much, anywhere. So this is really unique. Thank you again, and happy Thanksgiving to everyone.